Hi everyone, I'm Georgina Loughnan and I'm a physiotherapist from Sydney who has a clinic for adolescents and adults with Prader-Willi syndrome. The management of obesity in people with PWS is essential for life. It's essential for a healthy life, for a good quality of life and for a longer life. But first of all, we have to find out why are they obese. And yes, we always associate obesity with PWS, but people with PWS don't have to be obese. It's hard work, but they can get to a point where they are not obese. It's a major role for anyone caring for and supporting someone with Prader-Willi syndrome to assist with reducing their weight when they are obese and preventing weight if they are not obese. But first of all, we ask, okay, why are they obese? Are they eating a healthy, nutritious diet? And if they are, well, then they should not be obese. So possibly they're eating too much or they're eating more than what their planned energy intake is for that day. If they are not eating a healthy, nutritious diet, well, then that's when help is certainly available. And seeking the support of a dietitian who knows about Prader-Willi syndrome is essential, because we know people with PWS, they only require 60 to 80% of the recommended energy intake for their age group in the non-PWS population. So it's a lot less food than what we think. And if you have an obese child, you can start by using the recommended dietary guidelines for people with PWS. So for children under the age of 7, we would use or recommend either about 6 to 7 kilocalories per centimetre of height. And if they're over 7 years or 7 years and up, it would be roughly 7 to 8 kilocalories per centimetre of height for weight loss. And if they are really obese, you would probably start at a higher rate, maybe around 10 kilocalories per centimetre of height to bring their weight down, and then you would reduce it further. It's very important to have a planned, healthy, nutritious intake, daily intake, including food and beverages for everyone with PWS, with lots of variety, roughly 45% of carbohydrate, and that's healthy, grainy carbohydrate, then 30% of fat, and maybe 25 to 30% of protein, of healthy, lean, fat-free or fat-reduced as much as possible protein. And remember, you need a nice colourful plate and lots of variety in their meals, so they don't get stuck on wanting to have the same thing every day, as we know they can with their rigid thinking. So once they have a healthy planned meal, it's important to try and know exactly what else they are having in the day, especially if they are obese or they are gaining weight and you want to reduce their obesity. If their main energy intake is good, then they are receiving energy intake from elsewhere, and that could be extra food or extra beverages. And that's what you work on to bring their weight down, to try and limit that excess. And it may be within the home or it could be outside the home. So if it's in the home and you feel that they are at a stage where food needs to be inaccessible, you could start with opaque containers up high, and maybe eventually the food sources need to be locked, because that will certainly help with their obesity management, and it will certainly help by decreasing the anxiety they have around food. But food is not the whole picture. Obviously, it is so important to have regular, effective exercise in their life for children as well as adults. And this is when they are on growth hormone or when they are not on growth hormone. Obviously, it's more important. But it's important to remember that growth hormone is not the be-all and end-all. Exercise is so essential for their fitness and for reducing obesity and for keeping them in a much healthier weight range. Regular and effective exercise really means working in an aerobic capacity as well as a strengthening capacity, because we know people with PWS have less muscle and they have weaker muscles, even when they're on growth hormone. Growth hormone certainly helps, but we also know growth hormone is not available to all people with PWS. So exercising to improve muscle strength so that they can exercise more aerobically is essential if you want to bring their weight down. It is not just for weight loss, it's also for fitness and for health and for any obesity-related comorbidities that improve dramatically with exercise. But stronger muscles work better aerobically, so we try to combine both. And you will also see the effects, your positive effects that increased endorphins through exercise will have with people with PWS. They are certainly much happier when they are exercising regularly and effectively. We have PWS appropriate weight and height BMI charts, percentile charts that you can aim for, and we also have them for adults. And it's a good aim if they are in the obese range to aim to bring them down into perhaps the overweight range first. And you take it in stages, you discuss it with the family or the caregivers, and of course with the person with PWS. But if we think of the acronym DEEP, we have diet, we have exercise, and the next very important thing for obesity management is environment. Their environment, we know, needs to be PWS specific. And yes, everybody is an individual, and some will require a more restrictive or a more protected environment that is not only going to protect them from accessing extra food, but it will give them and their caregivers the encouragement to keep them active, and also in an environment that is calm and consistent and stable, that will reduce their overall anxiety and improve their behaviour and improve their commitment to exercise and to managing their energy intake. So the last letter of the acronym is P, and we talk about having a purposeful life, and this is for children as well as adults with PWS, especially if they are obese, because keeping them occupied, thinking about other things, just detracts them from thinking about food most of the time. And if you have someone who is obese, who you are trying to help or assist them lose weight to come down into a much healthier weight, we need to think of other things that they can think about and participate in to take that focus off food all the time, because it's not easy initially. They want to have all the food they've been having if they're obese. So when you start to make changes, you need to offer them other things to think about as well. So obesity management is certainly possible with people with PWS. It's not just possible, it's essential for them to have a healthy, long life, to help them have a better quality of life, so that they can do as many things as possible that their peers do.